Season 2, we're on to Season 2, the War on Poverty. Voting rights, Episode 1, Head Start, 1965. How many people here work in or ever worked in Head Start? Remember, the takeaway for Head Start is that Head Start, Norman talked about silos, Head Start wasn't a silo. It was a part of a large social reform movement, the War on Poverty. It was a part of the civil rights movement. My husband was one of the people that went to Mississippi in 1964 to work on voting rights, to work on freedom schools, to really make the difference that if you go, don't miss Selma, go see that movie because it teaches us a lot. But Head Start, which really is the precursor of preschool for all, Head Start was a part of a larger social movement. And I think that's something that we have to remember. Childcare doesn't exist in isolation from poverty, from economic insecurity, from all the things that our families, and sadly, many of us in the childcare workforce face. So the other thing to remember about Head Start, it had a great name. If you go to Congress now, I guarantee you that even the newest members across the aisle, Republicans and Democrats, everybody knows Head Start. And while there may have been criticisms, it is the longest sustained child care program in this country, starting way back in 1965. Season 3. This wasn't my favorite season. This is when I got started, 1971. And I was so excited to work on national child care legislation. When my twins were just babies, we actually passed a national child care bill in 1971, the Mondale-Bradamus bill, bipartisan support, something we could never even dream of now. And what do you think happened? And it was a bill that would have really provided for the diverse delivery system that we all want to have, homes and centers, schools and nonprofits, private and public. It was a wonderful bill. But guess what happened? The president, Nixon, he came to a sorry end, but the president vetoed that bill, saying, quote unquote, I am vetoing this bill because it will Sovietize America's children. And the good news, there's no good news in that veto because it's taken us a long, long time and we've never caught up. But the good news is that no one would dare to say that now. No one. I mean, that sounds, I mean, you gasped and I'm glad you did because it's almost unbelievable. But it was an enormous setback for all of us because we worked really hard and we were on the cusp of building from the roots of Head Start, rebuilding from World War II, and realizing that we really needed a national child care program. But with the stroke of a veto pen, we lost it. So episode 2 in that 70s chapter is that the women's movement actually did try to work on solutions. And you may have seen in the Chronicle this week, there's a movie that I can't wait to see. It's called She's Beautiful When She's Angry. And one of the things, I have 2 friends that have already seen it, and I have a friend that was in my original women's small group that's in it, but one of the things that is evidently prominently featured is how important childcare was to many of the early people in the women's movement. So that's a chapter that isn't necessarily enshrined in the women's movement, but I'm so pleased and I want to see the movie, and it just reminded me of why I got involved. Because I couldn't keep my job of teaching French in a private elementary school if I didn't have childcare for my kids. Now, in the 70s, San Francisco was a landmark leader. We applied for and got more funding for nonprofit childcare centers. In 1972, funding opened up so that in addition to school districts, funds could be available for community, neighborhood-based nonprofit centers, and many of you work in them today. And they are wonderful programs, and we were great advocates. We worked together, we coordinated funding applications, and we got more money than anyone. Sometimes you almost, in other parts of the state, you have to kind of say, gee, sorry, but we were a little bit ahead of our game because we were organized, because we worked together, because we were coordinated. Now here's a little story for Ashley and another kudo to San Francisco State. The 70s was also when the Child Care Switchboard Children's Council said, wait a minute, what about family child care? We got a grant to work on helping, it was a federal grant, and Silene Chansu was one of the first trainers. And the idea was that we would be going neighborhood by neighborhood, sort of like the Family Child Care Network, neighborhood networks I think that are happening now, to provide training in Cantonese, in Mandarin, in Spanish. And it was a wonderful program, but come to find out, many of the people couldn't get licensed because at that time in San Francisco there was a law that said if you didn't speak English, you couldn't get licensed. Can you believe that? 1974, that was the law. Well, we changed that with the help from the Child Care Law Center and early advocates at Public Advocates. But the other thing, the way that that project started is that another department at San Francisco State University, the Department of Social Work Education, under the incredible leadership of the late Virginia Turner, and actually I'll give you the whole story after this. She sponsored the network's application for a grant to do the family child care training. It was money that had only been used for foster care, but I said, well, why couldn't it be used for family child care? And they gave me a 3-day extension, the feds, to get the application in if I could find a school of social work that would support it. And happy for all of us, and I hope happy for family child care providers in San Francisco, it was San Francisco State University that led the way. So that's a little chapter that I don't want to forget. Jerry Brown was elected in 1975. I had the honor of serving him for 8 years on his Child Development Program Advisory Committee. He was a little more enlightened about child care and early childhood education in those days, wanted to see that it came to more people, a little more generous than he is right now. So it gave us an opportunity, though, I think, to bring child care services to many parts of the state where they didn't exist. And it was called the Alternative Child Care Program because beyond San Francisco in 1975, if you took a Polaroid picture of child care, most of it was around San Francisco, San Jose, Los Angeles, but the whole rest of the state was vacant. And there wasn't an infrastructure to build on, so part of what he wanted to think of is how do you get dollars into communities, especially small rural communities, where there may only be 2 or 3 providers in one center. And that was the birth of the Alternative Child Care Program. He also understood that if you wanted parents to have a choice, which was important to him, then they needed to know what those choices were. So the pioneering work that we had done at the Child Care Switchboard, starting with a $14,700 grant from the San Francisco Foundation in 1972, he understood that there was a public role for getting the best information to parents. And as we evolved the Child Care Resource and Referral Service model here in San Francisco, we recognized that giving information to parents was only part of our job. The other part of our job was paying attention to the working conditions, the availability, the affordability, and the accessibility of child care for all families in San Francisco. So we were very pleased that that legislation also included money for R&R. Well, there was another federal effort in the 70s, right at the end, 1979, Episode 5, you may never have heard of it, S4, the Child Care Act of 1979, authored by a San Francisco, our then senator, this was before Dianne Feinstein and Barbara Boxer were our senators, this was Alan Cranston, and he kind of tried to pick up the pieces from the Mondale-Bradamus bill in 1971, but already things were really contentious. I think I testified for that bill twice, but it got shot down, and there was a big war that started, and I'm sad to say that some of these little skirmishes are still going on about who will be the prime sponsor. Will it be school districts, or will it be a mixed delivery system? And that sort of internal fight was a part of why that bill never really succeeded. So I think we've come a long way since then, certainly here in San Francisco we have, but it's worth remembering that our divisiveness, when we are divided, it really hurts us. Okay, we're moving forward. Season 4, 1986 to 1990, this was the period where we got together and said, okay, we've waited 15 years since that bill was vetoed in 1971. What can we do to get national child care funding back on the agenda? Because even with the generosity of cities and counties like San Francisco, even with a state budget that was rosier then, we still had waiting lists, we didn't have enough, and many parts of our state were unserved. So the Children's Defense Fund mounted the campaign for the Act for Better Child Care. They did it working with child care state leaders from across the country. They sort of went around and figured out who was doing important on-the-ground work. And so it was a collection of center directors, family child care leaders, R&Rs from across the country, especially from key states, that started working and meeting in 1986 in the 4-H Center outside of Washington, D.C. with bunk beds, I think. I mean, it was pretty rustic, but we put our heads together and worked really from 1986 to 1988 on what would a bill look like. Now, by now, we have George Bush is the president, so we knew that there was going to be a lot of give and take. But when the Act for Better Child Care was introduced in 1988, it was a milestone. And then we started the hard work of that campaign. So remember, 1986, it passed in 1990. And I think what's really important to remember is that it didn't just happen in Washington, D.C. There were mobilizing efforts, organizing efforts across this country. And the one that I want you to remember happened here in San Francisco and about 10 other cities in 1988. It was just after our wonderful Speaker Nancy Pelosi had been elected to Congress. And you made in child care centers, I remember that Holy Family Day Home was one that produced a lot. Thank you, Donna, and those before you. Many of you probably were a part of that project. We made paper chains and we encircled the federal building. You know the old federal building down on Golden Gate? And so Nancy Pelosi and myself and lots of other folks, I think Norman was there, we had this very dramatic, very visual representation of how families and children were locked out of childcare, chained, because we didn't have the money that we needed. And that's the kind of creativity that we really need to bring to our efforts, because nothing happens without a lot of hard work. I think personally, I testified in Washington at least 3, possibly 4 times. Lots of different people. I remember one of the testimonies was on my 50th birthday with the late Senator Kennedy, who was amazing, but also with Republicans. And I think one of the things that was so different then is that there really was a bipartisan understanding of the importance of childcare, and that's something that we've lost. So, episode 3, the CDBG passed into law. It was a major victory. For many states, many parts of the country, the money that came with the Child Care Development Block Grant was the first public funding that they had ever had for child care, right, Barb? I mean, this was groundbreaking. But with any victory comes compromise, and compromise is a part of the public policy process. But what you need to know is the field passed that bill, but the president had a lot of sticking points. And some of those sticking points and some of those compromises haunt us today. One of the big shifts, if you think about the only other federal child care program in place at that time, was Head Start. And Head Start, the money goes from the feds directly to grantees, not to a state intermediary. Well, in the block grant, the president and most people agreed that's not a system that's really going to work. We want the states to have a leadership position, but a lot of the states our state was pretty well equipped because we already had a history of providing childcare services in our Department of Ed, so they were a natural to become the single state agency. That's what it was called. But in many states, there was a lot of growing pains. So that shift to the states was a big one. The president insisted on a parental choice system so that 75% of the original dollars had to go to a system of parental choice, meaning here in California, our alternative payment program. Now, California today is one of 5 states that still has a mixed delivery system. And when I say that, I mean contracts that go directly to a child care center and alternative payment vouchers that go with the family. We think a mixed delivery system works really well, but in many parts of the country, they've never had a mixed delivery system. They've only had the parental choice voucher system. And that wouldn't be the challenge that it grew to be for many states if the Child Care and Development Block Grant had provided not only money for subsidies, but enough money to address quality and training. And it didn't. I mean, we got as much as we could, but it wasn't enough. So it also ignored, I won't say the bill ignored, the bill also opened up. This was a really important point for George Bush. He wanted public funding to be available for the first time for family, friend, and neighbor care. That had never happened before. People kind of ignored it in the beginning. It was just kind of like, oh, okay, we have to make this happen. But by ignoring it for many, many, many years, in my opinion, we really neglected a form of care that is very important to the lowest income workers in this country. Because if you work swing shift, if you work changing shifts, and maybe Sandy Blackman can give us a sense of what percentage of the parents that are being served in our alternative payment program in San Francisco are working that, but you know that in a city where, at least the last time I saw some, a lot of our parents that were serving in subsidized childcare are working in the healthcare industry. And you know, and I know from spending more time in hospitals last year than I ever would have wished, there are shifts around the clock. And not just the shifts for people who make enough to pay for childcare, i.e. the nurses. I'm talking about the nurses, aides, the janitors, the people who really do the grunt work. And they don't even often know what time they're going to be at work the next week because their shifts change all the time. So family, friend, and neighbor care, in my opinion, is a really important part of our system. We should embrace it. We should support it. We shouldn't, as many people did for about 20 years, just put it over there or condemn it. And I'm old enough to remember when we started the Family Child Care Project in 1974, people used to talk about licensed family child care the way they talk about licensed exempt care now. Let's stop that. There's room for all of us in this field. Okay, season 5, making child care work better and welfare reform. State advocates, now we're heavy into the, almost 2000. We're beginning to have congressional hearings about what we can do to get more money into the block grant, and also what we can do to make it work better. Now, one of the things that was missing from the advocates who worked on the Act for Better Child Care, hence the Child Care and Development Block Grant, there were providers, there were R&Rs, there were state advocates, but there weren't parents. And I was asked in 1995 by a small foundation here in the Bay Area to say, what did I think was missing from the picture, 4 years, 5 years after we passed the Child Care and Development Block Grant. And I said, what's absolutely missing are the most important voices of all, parents. And it's not that they don't care. I have never talked to a parent who didn't want the very best for their children. But if you don't know how the system works, if you don't even know how to get enrolled, or if there's your number 2001 on a waiting list, you know, what are you going to do? So it was the impetus in my personal journey for Parent Voices, and I know there's folks here from Parent Voices. I hope all of you will stop by their table. But